Hi folks, welcome and thank you so much for coming today. If you'd please take a few minutes to complete the pre-test that's inside your folder, we'll begin shortly. And Lauren will come up here shortly to speak.
Hello, today I will be talking about an OT's role in sleep with patients with TBI and PTSD. The presenters will be Elise Mitchner, Kaylin Kennedy, Jamie Mitchell, and me myself, Lauren Hazel. Okay, so the learning objectives for today are: describe the mechanics, components, and stages of sleep, describe typical patterns of healthy sleep, be aware of personal factors that impact sleep, understand the factors that impair sleep in clients with TBI and PTSD, be familiar with assessments performed for sleep, describe cognitive behavioral therapy intervention for insomnia, understand the use of different assistive technology devices, be familiar with activities that promote sleep. To start off, I will tell you the definition of sleep and the functions. So according to Merriam-Webster Dictionary, sleep is defined as the natural periodic suspension of consciousness during which the powers of the body are restored. Sleep plays a key role in brain development and function by forming new pathways and processing information. According to newsmedical.net, research has shown that adequate sleep helps to improve memory and learning, increase attention and creativity, and aid in making decisions. Sleep additionally plays a role in the healing and repair of cells. So, what happens when you sleep? Sleep allows for improved concentration and response rate. Sleep helps to ingrain learning and memories. Sleep additionally provides a time when the removal of toxins in the brain can occur. Body structures impacted by sleep include the brain, the heart, and the lungs. The systems that are impacted during sleep are the limbic system, which is a system made up of nerves and pathways in the brain that control emotions. And the immune system is impacted, and this is the system of cells, tissues, and organs that work together to protect the body from infection and diseases. And then the metabolic system, which is a system that has chemical reactions that sustain life in a human being or in an animal or whatever. So dreaming also, it occurs during sleep, and they say that you dream about 2 hours a night, and we're unsure why people dream, but it occurs and it helps to process emotions. Now Elise will present on the anatomy of sleep.
Hello. Next, I'm going to talk about the anatomy of sleep and the different structures involved. So first off, we'll talk about the hypothalamus. And this is located right here in the brain, kind of in the middle, and this is the control center for sleep and arousal. Second structure is the brainstem, which consists of the pons, medulla, and the midbrain, and this is right here, all of this combined. And this communicates with the hypothalamus to control wake and sleep transitions and plays a role in REM sleep. During REM, as Lauren discussed, the brain signals to relax the muscles essential for posture and limb movements, so you're not acting out your dreams when you sleep. And then the next is the thalamus, and this is the relay center, which sends signals to the cortex. The thalamus is right here. And during most stages of sleep, the thalamus becomes quiet and allows you to tune out everything going around you. But during REM, the thalamus is active and sends images, sounds, and sensations that actually happen in your dreams. Next, we have the midbrain, which is right here. And this consists of the corpora, quadrigemina, and the cerebral aqueduct. And this is the system for arousal. And finally, we have the cerebral cortex, which is responsible for the interpreting and processing information from short to long-term memory. And this is just all around. Next, we have the suprachiasmatic nucleus, which is located inside the hypothalamus. And it's kind of hard to see, but it is right here. There are a group of cells that receive information about light exposure and control behavioral rhythm. And some people who have damage to this area sleep throughout the day because they're not able to match the circadian rhythm of the dark and light cycle. And then finally you have the pineal gland, which receives signals from the SCN and increases the melatonin production. And this is located right here. And melatonin is a hormone that helps you sleep when the lights are off. And then our last two structures are the basal forebrain or the basal ganglia, which is near the front of the brain and promotes sleep and wakefulness and releases adenosine to help support the drive for sleep. And then finally the amygdala, which processes your emotions and is active during your REM sleep. Next, we will talk about the sleep mechanisms. So you have, for your internal biological mechanisms, you have two types of how it works, is the circadian rhythm and the sleep-wake homeostasis. And both of these work together to regulate when you're awake and when you are asleep. So first, the circadian rhythm are fluctuations in wakefulness, body temperature, metabolism, and hormone release. And this controls the timing of sleep. So you become sleepy at night, and then you have to become more wakeful in the morning. And this is obviously, you don't have to, like for some people, you don't have to have an alarm. And then this synchronizes with the environmental cues, so like light exposure and then temperature are examples. And your circadian rhythm is about a 24-hour day, typically. And then we have the sleep-wake homeostasis, which keeps track of your need for sleep. And this regulates sleep intensity. When deprived of sleep, you sleep longer and more deeply. And then factors influencing sleep-wake needs are exposure to light, medical conditions, medications, stress, sleep environment, and food or drink intake. And research has shown that the greatest influence of sleep is the exposure to light. Specialized cells in your retinas of your eyes process the light and tell the brain whether it is day or night, and you can advance or delay the sleep-wake cycle. Next, we will talk about the components of sleep. During sleep preparation, we have sleep-promoting neurons, sleep-promoting neurotransmitters such as the GABA, and the creating a sleep hygiene routine. For sleep participation, you have sleep latency, which is how long sleep lasts, and this should be less than 30 minutes when you go to bed. And in sleep duration, it varies with age, but for school-age children, you should be getting 9.5 hours. For adults, 7 to 9 hours, and for older adults will be less, like around 6. And this can also be impacted by genetics, along with other sleep disorders. And then sleep maintenance versus, I don't know. And then also we have daytime sleepiness and dysfunction.
Alrighty, so for the stages of sleep, there are two types of sleep. There's the rapid eye movement, which is REM, and the non-rapid eye movement, which is non-REM. And non-REM has 3 stages and REM has 1 stage. So to begin, stage 1, so for stage 1, during this stage, the person goes from a state of wakefulness to a state of sleep in a matter of several minutes. This stage is considered very light sleep, and there are decreases in bodily functions such as slowing of heartbeat, breathing, eye movements, brain waves, and the muscles begin to relax. Moving on to sleep stage 2, which is another non-REM sleep. In this stage, muscles relax even more, heartbeat and breathing slows further, body temperature drops, and eye movement stops. Brain waves slow down even more, except for random short bursts of electrical energy. And in this stage is the most return to sleep stage during the sleep cycle compared to any others. For stage 3, which is the last REM sleep, or non-REM sleep, during this stage, the heartbeat and breathing slow to their lowest levels during sleep. It consists of a longer period of sleep, and the muscles fully relax. Brain waves slow even more. This stage is vital to feel refreshed and energized in the morning. And because this is a stage that has pretty deep sleep, the deep sleep helps improve learning, cell and body recovery, and long-term memory. Now moving on to stage 4, this is the REM sleep. So in this stage, it occurs for about 90 minutes, and it consists of rapid eye movement under closed eyelids. Brainwave activity increases along with increased breathing. Heart rate and blood pressure increase to near wakefulness levels. Most dreams occur in this stage. Limbs become paralyzed to prevent sleepwalking and acting out of dreams. As individuals age, they spend less time in the REM sleep stage. Alrighty, and then client factors that may impact sleep. These include work, school, and life events. So it could be having demands at work, school functions, or social interactions at school, and life events that may be stressful. This can all impact sleep. And then pain and fatigue can impact sleep, such as the position you sleep in due to pain. You might be sleeping one way versus the other, how long you sleep, and when you can fall asleep. And then balance, vision strength, and skin integrity also impact the way you sleep and your positioning when you sleep, and how long you can sleep. And then psycho-emotional statuses can also impact the way you sleep. So this can include depression, anxiety, and stress. Drugs, alcohol, and nicotine can make sleep almost impossible due to them making the person jittery, or just making the brain work more. Making the brain, no, never mind. Okay, so, and then caffeine can cause insomnia and jitteriness. And then the environment, whether it's cold or hot, loud or quiet, dark or light, that can also have a major impact on the sleep and sleep quality. Okay, so for the impact of lack of sleep, so lack of sleep can decrease cognitive performance, including alertness, reaction time, memory, learning, and decision making. It is found to cause more riskiness in decision making. Very often, sleep problems could impact on daily occupations, such as work, daily activities, and social performance and overall well-being. Inadequate sleep has been linked to obesity, stroke, heart disease, cancer, high blood pressure, diabetes, as well as deficits in psychological health, such as depression and decreased empathy.
Next, we will be talking about what is healthy sleep. According to the National Sleep Foundation, healthy sleep patterns include the following. You fall asleep within 15 to 20 minutes of lying down. You regularly sleep a total of 7 to 9 hours in a 24-hour period. While in bed, your sleep is continuous. So you sleep all the way through the night, and you're not lying awake for lengths amount of time when you wish to be falling asleep. You wake up feeling refreshed. You feel alert and are able to be fully productive throughout the working hours. And your partner or family members do not notice any disturbances or anything out of the ordinary, such as snoring, pauses in breathing, restlessness, or nightmares during the night.
Alrighty, and next we'll be talking about diagnoses and impaired sleep. So PTSD is associated with difficulty falling asleep, reduced quality of sleep due to arousal and nightmares, and physical pain. According to the study by the Journal of Traumatic Stress, 44% of combat veterans with PTSD had difficulty falling asleep, compared to 5.5% of combat veterans without PTSD. They found that re-experiencing symptoms from war combat reduced the quality of sleep due to arousal and nightmares. Also, the reduced sleep is associated with physical pain. In turn, pain could serve as a constant reminder of the traumatic event, triggering an arousal response, reduced sleep quality, and ultimately an escalated level of distress. After looking through much literature about PTSD and sleep, it seems as though sleep disturbances such as nightmares and insomnia are primary features of PTSD. And then TBI is also another diagnosis that can affect sleep. According to a clinical psychology review article on TBI and sleep, objective sleep studies have shown that patients with TBI exhibit reduced sleep efficiency, increased wakefulness after sleep onset, increased sleep onset latency, alterations in sleep architecture, less REM sleep, more time in light non-REM sleep, and report more frequent insomnia. Compared with the general population, those with TBIs are much more likely to experience sleep disturbances and are 12 times more likely to have diagnosed sleep disorders.
Hi, I'm Jamie, and I'm going to talk a little bit about sleep impairment specific to diagnoses. And first we'll start off with impaired sleep and PTSD. So just a little refresher on PTSD, it has to meet certain criteria. And that criteria is exposure to an event involving death or threatened death, injury, or sexual violation, experience of intrusive symptoms associated with the traumatic event, frequent avoidance of reminders associated with the traumatic event, changes in thoughts and mood that have occurred or worsened after the traumatic event, and then changes in arousal have started or worsened after the event. So it's believed that one of the causes in the sleep disturbances involves the dysfunctional rapid eye movement cycles, and it's not known if this is the central problem in sleep impairment with PTSD, or if it's just due to an attempt of to process the distressing material or the traumatic event that they're dreaming about. It's been concluded that increased REM density is associated with PTSD. So next, let's talk about TBI. TBI has an impact on sleep, and the impact really depends on the part of the brain that was affected due to the traumatic brain injury. So coup and contra coup injuries often occur at the base of the skull and cause damage to the basal forebrain, which is the area that's involved in sleep initiation. So these TBI patients might often experience symptoms of insomnia, whereas closed head injuries may involve the suprachiasmatic nucleus, which leads to a disturbance in the circadian rhythm. So this is where they're not following the patterns of day and night, but they may be sleeping more during the day. Some common complaints of people with traumatic brain injuries is insomnia, fatigue, and sleepiness. And then less common are narcolepsy, sleep apnea, periodic limb movement disorder, and parasomnias. And in some cases, post-TBI insomnia is a manifestation of the circadian rhythm sleep disorder, typically delayed sleep phase or regular sleep-wake cycle. Patients with mild TBI were found to have less efficient sleep and longer sleep onset latencies. So here's just a video about sleep and TBI.
I think probably over the last 10 years, I've noticed a degraded memory, and focusing on reading was almost impossible. I could read maybe a sentence or two, but have to read it 4 or 5 times. Being able to sleep was a huge one. I wasn't really able to sleep, but maybe 6 hours every 4th or 5th night. That kind of recharged me, and then I'd go 3-4 days with maybe 3 to 4 hours of sleep, and my wife was pretty much just about done with me. The anger issues were coming to a head, and she knew something that needed to be done.
I didn't know that some of the things that I was seeing were symptoms of traumatic brain injury. I didn't know confusion, trouble sleeping. I didn't even know what TBI was.
So some psychosocial factors to keep in mind when treating patients with PTSD or TBI. Patients with PTSD often have intrusive memories. They have feelings of trauma recurrence. They may have avoiding behaviors. They want to avoid those maybe those everyday events that trigger their PTSD. For example, a combat vet may not really appreciate the 4th of July as much as other people do, because those the fireworks sound a lot like the mortars that they heard overseas. That could trigger a PTSD event for them. Changes in arousal and reactivity, emotional shutdown, and there's increased rates of homelessness, poverty, and incarceration in people with PTSD. Some psychosocial factors to take into account with those with TBI are often depression. Suicide ideation is a common occurrence in folks with TBI, especially in that first year after they have their brain injury. Anxiety, pain, there's sometimes memory deficits, very similar to dementia, attention deficits, increased stress and pressure, and they often have maladaptive behaviors. So let's talk about assessment. Although impaired sleep is highly prevalent in the TBI population, there are really no instruments that have been specifically developed to assess sleep in adults with TBI, whereas in PTSD there is a specific addendum for the Pittsburgh Sleep Quality Index, and sleep disturbances reflect a core dysfunction underlying PTSD, specifically disruptive nocturnal behaviors. So as an OT, you want to frequently assess your client and see what maybe is causing their sleep impairments. You want to assess their habits, their roles, their routines. Like, do they exercise right before they go to bed? Do they read emails that may, get them upset or excited right before they go to bed? Do they nap in the middle of the day? Maybe that's what's causing them having a hard time getting to sleep. The ultimate goal is to promote health and improve quality of life for your client. So there are a couple of sleep assessments that you can use. There's a self-report questionnaire or interview, and some of those questions that you're going to ask, you just really want to assess the quality of sleep, the quantity of sleep, what their sleep routine is like, the timing of their sleep. Do they try to sleep during the day? Are they a shift worker? Or do they have like a normal nighttime routine, or is it just all over the place? And also whether or not they have daytime sleepiness. There's a tool that we'll go over, it's a sleep diary that you could have your client complete. And there's the Pittsburgh Sleep Quality Index, which I mentioned earlier. They have an addendum specific to PTSD, and we'll go over that. There's a functional outcome of sleep questionnaire, which I think is a really good tool for OTs to use. And then also, with modern technology, we also have a lot of data that we can get from Fitbits or applications on your phone. So the self-report interview questionnaire, you just want to ask them basic questions like, do you feel like you get enough sleep? Do you feel refreshed after a night of sleep? Do you sleep at regular times that fit with preferred daily schedules? What time do you usually wake up? What time do you usually go to bed? Where do you sleep? I mean, I can't imagine somebody's getting great sleep if they're having to sleep on the couch every night, so that could be an easy fix. So you could also have them fill out a sleep diary. So going over, this is just a basic sleep diary, you can find it online. And you will have them fill it out, and really you're really going to press them the importance of filling this out and being honest about it. Because then maybe you could see some patterns, perhaps they're drinking a Diet Coke every night at 9 p.m. and then they wonder why they can't fall asleep at 9:30. So the columns here is what time they went to bed, what time they got up, how many hours did they sleep for, how many times they woke up in the middle of the night. And then in the evening, they want to complete how many caffeinated drinks did they have, what time was the last caffeinated drink that they drank, if they exercised and what time they exercised, and what did they do the hour before they fell asleep. So I know we're all guilty of being on our iPhones or our computers or watching television. That really doesn't promote good sleep. So finding out this information from your client will help you teach them how to better adapt their behavior so they can get better sleep. And it also asks you to rate your mood. So that's just one way to maybe find correlation between your previous night patterns. So the Pittsburgh Sleep Quality Index, we'll talk about the addendum for PTSD. It's a self-report index that asks clients to rate the frequency of the following disruptive nocturnal behaviors. And they will rate them as a 0, which that it didn't occur in the past month, as a 1, where it occurred less than once a week, 2, once or twice a week, or 3 is 3 or more times a week. So they want to rate whether or not they had hot flashes, general nervousness, memories of nightmares of traumatic experience when they wake up, severe anxiety not related to the trauma, bad dreams not related to the trauma, episodes of terror or screaming without fully waking from that episode, or episodes of acting out their dreams, such as kicking, punching, running, screaming. Another assessment that you might use is the functional outcome of sleep questionnaire. And this examines the repercussions of daytime sleepiness on the activities of daily living or your instrumental activities of daily living. And it can be used to measure the effectiveness of treatment as well. And it's a 30-item report, a questionnaire, and you score it on a 4-point scale. The domains include activity level, vigilance, intimacy and sexual relationships, general productivity, and social outcomes. And some of the questions on the functional outcomes of sleep questionnaire: do you have difficulty concentrating on things because you're sleepy or tired? Do you have difficulty working on a hobby? For example, sewing, collecting, gardening, because you're sleepy or tired? Do you have difficulty in operating a motor vehicle for long distances? Do you have difficulty getting things done because you're too sleepy or tired to drive? Do you have difficulty visiting your family or friends in your home because you become too sleepy or tired? Do you have difficulty performing employed or volunteered work because you're too sleepy or tired? So as you can see, these are very related to occupational therapy. And they will be rated on 0, I don't do this activity, or 4, no difficulty, 3, yes, a little difficulty, 2, yes, moderate difficulty, and then 1, yes, extreme difficulty. And lastly, With modern technology, you can get quite a bit of information from your Fitbit, or there are many applications that you might be able to use to monitor your sleep patterns. I personally have used Sleep Cycle, and it's also an alarm, but it tracks your sleep patterns. It tells you how long you're in an awake period, a sleep period, or a deep sleep period. So that's possibly a good way to see if your client is frequently awake throughout the night too.
Okay, so now we're going to talk about interventions for sleep disturbances for people with TBIs and PTSD. So one of the ways that we can look at interventions is through the PEOP model, the People, Environment, Occupation, Performance. And so through this frame of reference, you get cognitive behavioral therapy, which can be used for insomnia, and we'll talk about that in a moment. You can also use activities, assistive devices and equipment, and also lifestyle interventions. So we're going to go through and talk about all of those. The idea is for the person, we're summarizing about their minimizing the influence of the bodily functions on sleep. Then with the environment, we're talking about promoting an environment conducive to sleep. And then with in regards to the occupation, we're talking about restructuring daytime activities. So cognitive behavioral therapy for insomnia. CBT is non-pharmacological, as many of you probably know since we're all occupational therapists. And it's considered one of the first lines of treatment for PTSD sleep disturbances. The big part of this is because it is non-pharmacological. Then according to Ekman et al., CBT for insomnia can significantly improve the ability to handle sleep issues in patients with PTSD, reduce their sleeping difficulties and nightmares, reduce dysfunctional sleep beliefs, and improve their ability to participate in their social roles. It's also been shown to alleviate sleep disturbances, increase sleep efficiency, and reduce symptoms of general and physical fatigue for insomnia associated with TBI. And to continue with it, we have, it's considered to be a safe and effective way to approach treating insomnia without using medication, which really falls within the lines of occupational therapy. The aim is to change the sleep habits and routines that perpetuate these sleep difficulties. And according to the National Sleep Foundation, cognitive behavioral therapy for insomnia includes regular, often weekly visits to a clinician who gives you a series of sleep assessments, asks you to complete a sleep diary, and works with you on sessions to help you change the way you sleep. So with the idea of using activities, some of these activities that you can use meditation, which can help to promote sleep. There's also yoga and nighttime stretching have also been shown to improve sleep in patients with PTSD and TBI, and also deep breathing exercises. So let's practice that really fast. So we're going to inhale for 4 seconds, hold our breath for 4 seconds, and then exhale for 8 seconds. So inhale, 1, 2, 3, 4. Hold, 1, 2, 3, 4, 5, 6, 7. And exhale, 1, 2, 3, 4, 5, 6, 7, 8. And if you repeat this method, this helps to calm the body by giving oxygen and relaxing the mind. And So here is a quick little video of a guided meditation that you could use for someone with PTSD or with TBI. This was found on YouTube. There are quite a few of them on YouTube, so a patient could go and they could look and find one that they particularly like. There's some that last for hours, so it could be done while they're sleeping. So we're just going to watch a few minutes of this just to hear what it's like.
your focus on your breathing, notice your chest rising and falling with each breath. You're learning how to relax. Notice how your relaxation can increase as you focus on your breathing. That's right. Now, in your mind's eye, I wonder if you can choose a color that to you represents a feeling of relaxation. It doesn't even matter what the color is. As long as for you, it feels relaxing. And if you can't pick a color, that's okay. Just think of a warm, pleasant feeling instead. Okay then, are you ready? Bring your awareness to the top of your head and imagine that this color or feeling of relaxation is like a radiant light, just hovering above the top of your head. And as you become aware of it, it begins to slowly wash over you like a warm liquid, feeling loving and embracing as you begin to drop down, down, further into relaxation.
Alright, so that was just a short little clip, and this one is like an entire hour of this meditation that someone could use prior to falling asleep. Other options for it, you could also, they could purchase like a CD. Sometimes podcasts are made with meditation techniques. And so there are lots of different opportunities and ways in which someone could find these different techniques for helping them to fall asleep.
Gently, quickly, and completely.
All right, so another intervention is assistive devices. So according to a study about occupational therapy and sleep management, the researchers found 6 articles that evaluated the effectiveness of different sleep aids. So these assistive aids, we've got Dream Pad pillows, which plays a soft and soothing music in the person's ear as they're falling asleep. So this helps to relax the mind and the body. Some studies have shown that this pillow significantly improved the duration and the quality of sleep and decreased the nightmare awakenings. There's also weighted blankets, which can also be used for people with autism spectrum disorder, but in sleep populations, it shows a increase in the duration and a shortening in the latency of the sleep. So it takes a little bit less time for the person to fall asleep, and they also stay asleep longer. Other options could also be that you could use eye masks, earplugs, and white noise machines. So some other assistive devices, eye masks, earplugs, CPAP, which is a continuous positive airway pressure, and so that sends air in through the person's lungs, it forces it in, and it helps the person to stay asleep. Oftentimes someone with like sleep apnea, when they're snoring, they are woken up constantly because they're essentially stopping breathing. And so the CPAP helps to keep it so that they don't stop breathing and are able to sleep with more thoroughly. There's also white noise machines, blackout curtains just to prevent light coming in. You can also purchase things like a sleep monitor, or you can get the apps that track your sleep patterns, which Jamie was talking about earlier. You can also get ones that help to soothe your mind and help with your quality of sleep. So you've got ones, there's the Sleep Cycle app, which tracks sleep cycle patterns and wakes you up in the lightest phase of your sleep. so that you're waking up, quote, on the right side of the bed. There's also sleep pillows, which produce like a white noise, and they also have an alarm in order to wake you up in the morning. Then for a lifestyle intervention, this emphasizes the promotion of healthy sleep habits and activity rescheduling and facilitation of role transition and aging through education, experience sharing, and goal setting. So a lifestyle intervention would be working on like sleep hygiene. In order to work on sleep hygiene, you want to maintain regular wake-sleep schedule. So making sure that you always go to bed at a certain time and always wake up at the same time. That consistency helps with falling asleep and then waking up again in the morning, making it easier. It's also important to establish a relaxing pre-bedtime routine with a quiet, dark, and cool sleep environment. We want to make sure that we're not using our pre-bedtime routine. We don't want to be like watching TV or looking at our phones directly, because those lights and sounds can activate our brain and make it harder for us to fall asleep and relax. They also recommend that we only use our bedroom to sleep and have sexual intercourse. Outside of that, we need to make sure that the bedroom, you avoid everything else in the bedroom so that it's meant as a place to sleep. You also should avoid exercise, caffeine, and alcohol a few hours before bedtime, and avoid using a smartphone, computer, or watching television before bed. And it's also beneficial if you sleep prone. It's been shown that lying prone results in more sleep and less waking patterns than lying in supine. All right, and if you have any questions, please feel free to email one of us. All right, and next we're going to have Elise come up, and she is going to talk about the post-test. So if you would just take a few moments and go ahead and fill that out, and then she will be up and talk to you about it. Thank you.
Well, I hope you guys learned a lot from this video. Let's see how you did on the post quiz. Question 1. What stage of sleep do you do the most dreaming? The correct answer is stage 4, which is also considered REM sleep. Stage 4 occurs for 90 minutes in sleep and consists of rapid eye movement under closed eyelids. Brainwave activity increases along with increased breathing, and your heart rate and blood pressure increase to near wakefulness levels. Most dreams occur in this stage. Limbs become paralyzed to prevent sleepwalking or acting out your dreams. As individuals age, you also sleep less for REM. Question 2. What is the number of hours a child in the school age should be sleeping? The correct answer is 9.5 hours. Question 3. What affects the circadian rhythm the most? The answer is light. In a study found, they showed that the greatest influence was exposure to light. Specialized cells in your retinas process the light and tell the brain whether it is night or daytime. Question 4. True or false? A sleep assessment has been developed for specifically assessing sleep for adults with traumatic brain injuries. The correct answer is false. There has been no sleep assessment developed specifically for adults with TBIs. And finally, question 5. DNB, often associated with PTSD, stands for, the correct answer is B, disruptive nocturnal behaviors. Disruptive nocturnal behaviors consist of hot flashes, general nervousness, memories about traumatic experiences, severe anxiety, bad dreams, episodes of terror, and episodes of acting out dreams. And these are our references. Thanks for watching.